My name is Dr. Richard Hilsden, and I am definitely a real doctor. Today, I'm going to blind react to Jubilee's Find the Real Doctor, and we'll see how I do.
I am a doctor.
5 are posers. 1 is the real deal. In a room full of liars, can these teams find the real deal?
Numbers 1 through 6 in that order. Could you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I'm an emergency doctor and went to UCF as well.
Physical therapist, Rutgers University.
I'm a pediatrician and I went to Drexel University.
I'm an optometrist and I went to Southern California College of Optometry.
Okay, so I'm going to just do a really quick guess here. I've heard them all talk about their specialties. Right now, if I were to pick, my guess would be number 1. So there's this quiet confidence of number 1 that impressed me. There's a vibe that she gives off that really actually none of the other doctors seem to present. So that's my gut feeling. I haven't seen the rest of the video, so we'll see if I'm right.
Number 6, can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at. And so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see. That's
correct. It's pretty commonly known what 20/20 and 20/30, whatever vision means. To call it complicated and there's a lot of physics involved, I think that's a bit strange. So I definitely have my doubts about number 6 right now.
Guys were on call. What was your least favorite thing to be woken up by?
A large accident with fatalities is always a grim scene to come into, especially if children are involved.
Okay, so I'm just going to comment right there. I'm a trauma surgeon, and that answer is a bit strange for someone who's a practicing doctor. Obviously, there's all kinds of terrible things that we see in the hospital every day, and trauma with children is certainly a terrible thing. But trauma, again, is in one of those categories of things where we have the ability to help. And when we find the most difficult things in our career, they typically are things that we can't help, or terrible injustices and things like that. Trauma, although there's lots of injustices that occur in trauma, when we're able to provide care to trauma patients, we oftentimes help them tremendously, and we can make them feel better and restore function. And usually it's actually more positive.
I think just seeing any babies in pain and then seeing like a tragic loss is the hardest thing.
So I'm also going to sketch out here on our pediatrician. So she said it's hard to see babies in pain. This gets back to really the attitude of a doctor. Again, pain is something we can help with. And we do very quickly kind of lose this emotional response to seeing other people in pain pretty early in our training. It's those injustices, the things we can't help, where we feel powerless as doctors. Those are the things that in our mind are the things that frustrate us and are difficult. And so again, I'm not hearing that come from this person, so it makes me doubt that she's a doctor.
We're ready to make an elimination.
Each team will try to find the real deal by eliminating the imposters. If both teams eliminate the same person, they will be removed from the game.
When you ask about why they don't like being called at night, it's so sad, and the children and this like general thing, I was like, okay, that's nice.
That was my impression too, for sure.
For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra, gosh, I don't remember off the top of my head.
Doctor number 4.
That's a bit of a sketchy answer. Again, number 1's the one I'm still guessing is the real doctor here, but inter, meaning inside, I agree with that. An intra is between, and there's lots of things in dermatology that would be intra, so I'm a little surprised that didn't come off right off the top of her head there, so we'll see.
Can you name me the different kinds of cruciate ligaments?
3? You said 3?
However many there are.
Oh
no.
We have the anterior, interior. You have a meniscus. Those are the main for knee.
Gotcha.
Okay, so right there we have another definite elimination. You're going to need to know that if you're in physical therapy. So the cruciate ligaments are the anterior cruciate ligament and the posterior cruciate ligament. I think he said intercruciate and then mentioned the meniscus, which is not a cruciate ligament, although commonly injured when there is an ACL tear. You could commonly have a meniscus injury as well. But again, that's stuff that would be really easy for any doctor, especially one in that field, actually mentioning. You can see it right here. She has her doubts as well. I think we've got another elimination.
Both teams have decided that one person is definitely not the real deal. Number 4.
I would love to hear your wackiest story from a patient on the job.
A vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle in her vagina.
Okay, so I've already been sus when it comes to number 2. As a general surgeon, one of the things I deal with are rectal foreign bodies, and that's really the term we use. Having an obstruction like that in the vagina is, I can't say impossible, but very unusual, and something like a bottle playing around would be strange. In urology, penile foreign bodies are extremely common, and you would have thought that, again, would be something that he would have mentioned, one of those stories, which are kind of wild and a bit hard to imagine.
For me, I had a guy come in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that. So that was pretty crazy.
So that is actually a really common injury, getting a foreign body in the eye and then getting traumatic uveitis. And the consequence of that is elevated pressure in the eye. So although I'm still leaning towards number 1, that is a very smart answer by number 6. And, you know, again, if this person is the imposter, she's done a great job at doing some research to have an answer like that. That's pretty good.
All right, we're good to eliminate.
Easy answer on that one.
You walk into the room and you see the patient's monitor, flatline. You feel their pulse, there's nothing there. How many joules are you going to shock them with? Doctor number 5.
5.
And doctor number 3.
200.
Doctor 1.
It has been a while since I've been in the ER. I am a dermatologist after all, but if I remember correctly, it's 150 joules.
Okay, and Doctor 6.
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
That's fair.
Okay. So I think this is actually a trick question, to be my guess, because the flat line in the monitor, I think they're trying to get at asystole, and asystole is not a shockable rhythm. We don't do defibrillation. I like the not sure answer by the optometrist. An optometrist really wouldn't have that much experience doing advanced cardiac life support, so really, why would they even know? Same kind of true, though, about the dermatologist, and the dermatologist's answer was 150 joules. The other answer that was absolutely incorrect was the pediatric doctor, the pediatrician. Even in children, 5 joules is a tiny amount of energy, and that's actually less energy that I use when I'm doing intrathoracic defibrillation for patients who we've done a traumatic thoracotomy. You can see my video about that. And that 5 joules is a tiny, tiny amount of energy. It would be even below what I would start with in that environment. So again, number 5, I think the pediatrician here just doesn't know the answer. Remains my next elimination for sure.
Okay. That was a question everyone got wrong. The answer is none, because you don't shock asystole. But that's something medical TV sometimes gets wrong. Everybody comes in there with the paddles ready to go.
I don't know. I don't know who's
I don't know anything
the real
anymore.
deal at this point.
What is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35
No, absolutely no.
beats per minute. It elevates by the
No.
time they're 1.
This is completely
obviously,
wrong.
So maybe like 40,
No.
maybe 45.
No.
Okay, I'm ready to make an elimination.
Okay, so first of all, newborns have high heart rates and they come down. If a kid had 30 beats per minute and was being born, that's basically peri-arrest. That is an absolute emergency. And again, most doctors would know that. A pediatrician would definitely know that. And that's easy elimination. So number 5 is 100%, even though I was obviously doubting it earlier, 100% not a doctor.
Doctor number 5. Thank you.
Thank you. She talked about the heartbeat for a baby. That gave it away.
She answered that a resting heart rate of a fetus or infant is 35, which it'd be very concerning if it was that. They'd be not alive.
Okay, I think we're gonna have a demonstration. I was just gonna have Dr. Number 6 do a little eye exam with my pen light on Andre, and tell us what she's looking for.
Let's see what Dr. Number 6 got. Is she a pro or not?
See those skills in action.
All right, so first I'm gonna be checking to see if your pupils are equally responsive to light and if they are equal in terms of size. I'm gonna do the direct response first, so just look straight ahead for me, please.
Direct is good. I like this.
Cool. So when I shine it between the two eyes, I'm looking to see if the other one stays constricted, because that means that there's like a good communication between like the brain. So that's what I'm looking for.
All right.
Okay, Doctor Number 1. Can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're gonna put them on Accutane, but that is a high-risk drug, so we have to make sure that the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Last thing, does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin, so it kind of just depends on your physiology.
Good answer. Good answer.
Being called that blows air into your eye.
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm
Red,
trying
green,
to
blue.
think.
It's definitely red, green, blue.
Red, green, and yellow.
Oh no! Oh no!
Number 3. Talk me through
Oh, no.
debating someone. What are you trying not to?
It's not yellow. That's wrong. I would have expected an optometrist to know that easily, right off the top of their head.
Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
Okay, so my final guess, I'm going to remain with number 1. I was really impressed with number 6 up until the cones of the eye and the yellow cone. That definitely messed it up for me. So again, my first impression, really how number 1 was carrying herself right from the beginning, impressed me, and that's carried me right through the end. And number 1 has really answered the questions quite well. So that's my guess. I'm a little nervous to see what the results are. Hopefully I don't get it wrong here. I'll be embarrassing myself if I can't pick out the doctor on my own.
We think the real deal is Doctor Number 1.
Dermatologist.
We think the real deal is Doctor Number 1. She didn't fumble on any of her answers, and the more that she kind of got into it, the more I felt that like she was a doctor talking to me as a patient.
If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter.
What's going to happen here?
The real deal will be revealed in 3,
Oh my gosh.
2, 1.
No.
Who is it?
Yes.
Dang.
Hello, teams. My name is Rebecca. I am not a doctor. I was in the medical field. My original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing.
Gotcha.
Because you're not able to find the real deal, we will reveal them to you.
6 for sure.
Oh, nice. Yeah, you're close second.
Right there.
I shouldn't have gone off the cones.
The cones got them, yeah.
I am Nicole, and I'm the real doctor.
Well, I got it wrong. I'm so sad. I will say, though, some impressive work by Doctor Number 1 and Doctor Number 6. We all make a little mistakes here. I made a mistake on picking the wrong doctor. She made a mistake on talking about cones, but that's okay. That was a lot of fun. Thank you for sticking around to this video. I watched this video blindly because of a comment in another video, and I appreciate those. Please leave a like or comment. They help me and inspire me to make additional videos. Once again, my name is Dr. Hilsden. You've been watching my channel, Knife Skills. Have a great day.